Pharmacodynamics. What happens to the body after drug administration? The topic for this video is pharmacodynamics, and this topic is very much important for all the pharma professionals. After the drug administration, the drug undergoes absorption, distribution, metabolism, and then excretion. So this ADME is called as pharmacokinetics or PK for the drug. And once the drug get absorbed, it will have its action onto the body, and those studies are done under the term pharmacodynamics. So in simple way you can say that pharmacodynamics is the study of what happens to the body after drug administration, and pharmacodynamics involves understanding the mechanism of action and the biological responses. Pharmacodynamics is the study of drug effects. Pharmacodynamics is abbreviated as PD, and it involves the studies which examine the biological and physiological effects of drugs, focusing on how they interact with their target sites. The target sites may be receptors, channels, ion channels, some enzymes. So how the drug interact and exerts its effect, that is studied under the pharmacodynamics. The main concepts or core concepts of pharmacodynamics are mechanism of action, dose response relationship, therapeutic window, and adverse effects. Not only these are the concepts, these are the main concepts. Some others are also there. In this video, mainly the core concepts will be studied. Mechanism of action. It simply means how the drug works or how the drug exerts its action. Mechanism of action means how drug exert their effects. These effects may be therapeutic effects or some toxic effects or side effects or adverse effects. The process by which the drug produces its therapeutic or toxic effects is called as mechanism of action or mechanism of drug action. Key concept in the mechanism of action is agonist, antagonist, partial agonist. Agonist means activate receptors to produce biological response. Example is morphine through the opioid receptors. Morphine provides action through opioid receptors. There are various types of receptors in the body. Drug may be agonist or antagonist or partial antagonist to these receptors. Agonist means activate the receptors. Antagonist means decrease the action through the receptors. Agonist activate the receptor to produce the biological response. Antagonist bind to the receptor without activating them and blocking the agonist effects. Partial agonist activate the receptors but produce submaximal response. Dose response relationship. It means the relationship or link between dose and the pharmacological effect. So dose response relationship describe the relationship between or link between the drug dose and the pharmacological effect. Key factors for dose response relationship is potency, efficacy, and steepness of curve. Potency means the concentration required to produce the given effect. Efficacy means the maximum effect of the drug can produce irrespective of the dose. And steepness of curve means how sharply the drug effect increases with dose. This is very common terminology in the pharmacology and in the pharmacodynamics. For example, if you give the dose of 100 mg, it will have some effect. If you give the dose of 200 mg, it will have more than the effect of 100 mg. So this is the concentration required to produce the given effect. If you go on increasing the dose, it will not increase the therapeutic effect, but it will produce side effects. So dose is very important in the study of pharmacology. Efficacy means the maximum effect, and stiffness of curve means how sharply the drug effect increases with the dose. It is not like that it will increase with every dose. At some point, it will be same compared to the lower dose, or it will lead to toxicity. So this is regarding the dose response relationship. Now coming to the therapeutic window. Therapeutic window means balancing the efficacy and the toxicity. So if you understand the dose response relationship, then you will better understand about the therapeutic window. For example, if the threshold dose, I mean to say that the minimum dose is, for example, 50 mg. What will happen if you give 25 mg? It will not produce the desirable uh, pharmacological action. So you can say that the dose should be 50 mg, and if you go beyond that, it will produce some toxic effects. So some dose window will be there, and based on that, you should understand about the therapeutic window. Balancing efficacy and toxicity. The range of drug concentrations that are therapeutically effective without causing harm. That means the toxicity, and this range is the therapeutic window. If the drug is having narrow therapeutic window, that means the dose is very critical. If you don't give the minimum dose, it will not exert any therapeutic effect. And if you increase by a small quantity, it will lead to toxic effects. That means the drug is having narrow therapeutic window. Key factors affecting therapeutic window are the minimum effective concentration and the minimum toxic concentration. Minimum effective concentration, that is MEC, the lowest concentration at which drug exhibits its therapeutic effect. And minimum toxic concentration means the concentration at which the drug begins to cause toxicity. For example, 100 mg is the MEC and 500 mg is the MTC. So the dose should be in this range. Then coming to the adverse effects or side effects, these are the unintended drug responses. These are the harmful or unintended effects resulting from drug use. Key types of these effects are off-target effects, hypersensitivity reactions, and idiosyncratic reactions. Off-target effects are those when the drug interacts with unintended receptors or biological pathways. Hypersensitivity reactions, these are the immune-mediated responses to the drug. These are commonly called as allergic reactions. Idiosyncratic reactions, these are rare, unpredictable effects based on the genetic or metabolic factors. So this is the information for adverse effect. Key differences between pharmacokinetics and pharmacodynamics. So as I have made a video on pharmacokinetics, I request you to go to that video and watch that video so that you will get good information about pharmacokinetics. This video is for pharmacodynamics. Now we will see what is the differences. So pharmacokinetics means what happens to the drug when the drug is administered, means how the body has effect onto the drug, and pharmacodynamics means how the drug has effect onto the body. That means what happens to the body. PK versus PD. Now we'll see the key differences. PK means what the body does to the drug, and PD means what the drug does to the body. PK measures drug concentration in the biological fluids like plasma, and PD measures biological responses like receptor activation, physiological changes. Applications for PK and PD are: PK helps to guide the dosage regimen, route of administration, and frequency. PD means it guides therapeutic targets, drug combinations, and understanding side effects. The knowledge of PK and PD are important to understand the pharmacology. Interaction of PK and PD in clinical research, integrating PK and PD for optimal drug therapy. The combination of PK and PD principles are important and provides a comprehensive approach for the drug therapy optimization. PK/PD modeling is a method that combines data from both areas to predict drug behavior and response, facilitating the personalized medicine. For examples, oncology drugs, antibiotics. So these principles helps to understand the dosage regimen required based on to the patient, based on to the requirement. Summary of pharmacokinetics and pharmacodynamics. PK/PD are the two sides of the same coin, you can say. Pharmacokinetics focus on how the body processes the drug or what happens to the drug, that is ADME. Pharmacodynamics focus on how the drug affects the body, that means what happens to the body due to the drug. Pharmacodynamics involves study of mechanism of action, therapeutic effects, and toxicity. Together, the PK/PD form the foundation of rational drug development and individualized therapy, ensuring the drugs are both safe and effective. Optimizing the drug therapy with PK/PD. So integration of PK and PD is essential for personalized treatment, for having the dosage regimen which are safe and effective, to have the better therapeutic outcome from the therapy. This is the information regarding pharmacodynamics and understanding the differences between pharmacokinetics and dynamics. I hope you might have got good idea about this topic. Thank you for watching the video, and let's meet soon with such kind of informative videos. Thank you.